A falling infection rate, that's a good thing, but a variant that may be more deadly, and concerns over the vaccine rollout and how quickly you get that second dose.
Good news is we've got two people who can always answer all your questions, and those are virologist Chris Smith and Linda Bauld, who's Professor of Public Health at University of Edinburgh. Very good morning to you both.
Morning.
Good to see you again. And Chris, I'm going to start a thought with you, if I may, first, and we'll pick up on some of the people's questions in just a moment. In relation to what was said yesterday, and people have been maybe opening their papers this morning seeing these headlines about the increased risk of death from the new variant. Now, do you want to just take us through some of the science behind that? Because on the face of it, it's an alarming headline, and then you look at the science. So can you just take us through that?
Well, we don't know for sure what's going on yet. Press briefing yesterday evening, you'll realise that the nuances there were we don't know exactly where we stand on. We have got fairly familiar with what the mortality rate is. Since September last year, this new variant has been increasing in frequency. Across the same time, we've seen a lot of people ending up in hospital, lost their lives. And when they've computed the cases, the mortality rate, the old variant, there's a suggestion, although it needs further confirmation, that there might be an increase in the risk of dying, at least for some sectors of the population. It might be 14 rather than 10. So that would be 14 people dying. That's 40% higher mortality rate than the previous strain. But I think at the moment we don't actually understand whether this is just an artifact of the fact that there are many, many cases. It's making it more transmissible. It's made it easier for the virus to spread.
Linda Bauld, in terms of the public health message then, taking all that Chris has said into account, given that we still have to wait, well, according to Peter Horby, Professor Peter Horby, who we spoke to earlier, a couple of weeks before we really know whether it is genuinely much more deadly. What was the motivation in bringing this piece of news, do you think, to the press conference yesterday? Because a lot of people see it as scaremongering. Peter Horby, who advises the government on these things, says it's just us being transparent. What impact do you think it will have on those watching and listening at home?
Well, that's exactly what I was thinking last night, Rachel. When I was listening to the press conference, I was trying to see what was the, what was the motivation, particularly for the Prime Minister to begin with that message. So I think that, as we heard with the new variant, the government is very, very concerned about the current situation in the UK, and they want to convey that to the public. So I don't think it was scaremongering. I think, though, it was a technique to emphasise that there is new data that may be alarming, and it's absolutely essential that the public are very cautious and that they follow the guidance. So I'd be careful. But I think certainly from the Prime Minister, we were hearing science being used there to emphasise the importance of following the current guidance.
Linda, we're going to stay with you for the first question, which is from Rose. Rose her mother is 93 years old, which is a fantastic age, still has not received an invitation to book a...
Yeah, so I can completely understand that she's concerned about this. So we know there's two potential scenarios here, that she's been contacted and the letter's been misplaced, or she hasn't been contacted. Not all of the over 80s yet in England or indeed elsewhere in the UK have received their first dose. Contact her mother's GP if she's very worried that there may have been an invitation.
Interesting, you came across a case like that just this week, actually. Somebody said their 90-plus-year-old mother had had a text inviting them for the vaccine, which she'd accidentally deleted, and they were really worried that she may have missed it. The question from David, and it's worth putting out there because a lot of people are asking similar questions. Myself and my wife, both over 70, I contacted our GP in Birmingham to be told they don't have any vaccine.
And I think David is another part of this discussion. So it sounds like David and his wife are in their 70s, I think, and it's important that we don't reach out repeatedly to the NHS asking about vaccination when they have the supplies that they need. But they will be coming down the track. I don't think that was a cause for concern there. And as you say, Rachel, it doesn't mean that there isn't some in the locality. So,
Chris, do you want to pick up on this one for us? This is from Jamie, who's got in touch, who said, once you've had the vaccine, can you still carry and transmit the virus to others?
We don't know is the unfortunately blunt and simple answer. And it's a question that's been put to the Downing Street press briefing a number of times, and it's a question that us doctors are getting asked quite a lot by this coronavirus. But it still appears that people can catch the virus under certain circumstances despite having been vaccinated but they won't become seriously unwell. It matters because, of course, if you can catch the infection, you can potentially transmit the infection. So that sort of study is ongoing at the moment. There's
Some Chris, of understanding immunity and how much immunity we get perhaps when we've contracted coronavirus. A good question from Joan, who asks, is having COVID for a second time becoming more widespread? I had it in March 2020 and have it again now.
We now know, thanks to Public Health England's Siren study that came out a couple of weeks ago, that there is a rate of reinfection. What they did was to recruit a pretty significant group of people, infections cropping up in the people who had coronavirus previously. 15 to 20% of people got the infection again. And so that shows us a couple of things. One, that antibodies fall with time and immunity to coronavirus infection is not that long-lived. So for as potentially susceptible in the future, at least until we get more clarity on this.
Linda, I mean, it's interesting, isn't it? Even though we have been living with the virus and people's worries about it for such a long time now, some of the questions kind of remain the same, or you go through the motions of asking them again. I just draw your attention to this one from Asmi, actually, who's got in touch this morning to us, saying, should I be washing my hair as well as my hands when I come home from outside and pass people in places such as the supermarket, or if they're out jogging?
Well, I mean, everyone is scunnered, Charlie. They're fed up, they're tired, they're asking the same questions because we need to be repetitive and we need to address people's concerns, and I think it's valid that we're getting. But certainly, from passing somebody jogging, etc., I mean, that doesn't mean that it's impossible to pick up the virus, but it's far less likely than through close, sustained contact. A couple of things about hair washing: there really isn't any evidence, significant evidence, that you will be carrying the virus on your hair. So it's the advice we've been following all the way through. Keep washing your hands, make sure you're physically distancing, and the hand and respiratory hygiene is the key thing. But we shouldn't be encouraging people to repeatedly wash their hair because they're...
Do antibacterial wipes kill the virus? We wipe our shopping when it comes into the house, but we don't know if we're wasting our time.
And things with alcohol in will denature or deactivate the virus. And that's on top of the fact that they don't tend to last that long on surfaces. So there are various studies showing that cutting to the chase, those sorts of antibacterial wipes, if they've got soap in them or a detergent in them or an alcohol base in them, then they will deactivate viruses of the type of that the coronavirus falls into.
There's been a statement of the obvious in a way. Was yesterday during the press conference when Chris Whitty, I think it was, said the virus is not going anywhere. It's probably with us forever. And I mean, Chris, do you want to pick up on that? I mean, it's something I think you've probably told us that.
And what he's hinting at is that we're of the opinion that this is going to become an endemic infection. Now, some infections, when you have an outbreak of them, a thing like this coronavirus, the SARS virus that came out in 2002 to 2003, it was so dramatic in its presentation. I mean, I'm not saying this one isn't, but in terms of how it affected each individual person, and it wasn't that infectious, we were able to stamp it out. But that half the people who get this infection have no symptoms whatsoever. And tell where the virus is, who's got it, and stop it. And because it's so infectious, it's so well adapted to humans, it will continue to spread and continue to propagate around the world. How to return to some sort of normality in future.
Linda.
I would absolutely agree with Chris, unsurprisingly. I think that it will become endemic. It's important to remember that it's very unusual to eradicate an infectious virus. So I think we did manage to eradicate smallpox, as you'll know, but we still have tuberculosis, malaria, etc. So it will become endemic, and we've got to develop a long-term strategy to deal with it, for example. And the big debate, of course, that's in the news again today is our borders. So we're going to have to prevent cases being imported into the UK, particularly it's going to take many years for vaccination to be rolled out, or several years around the world. So in many ways, nobody is safe until we're all safe. So that's going to be something we need to keep in mind.
Linda, can I be completely frivolous for a moment? Because I was this morning and I didn't pick. Are they Alstroemeria that you have there?
Yes, that's spot on. Yeah, they last such a long time.
Yes.
So. Yeah, so thank you for the nice words on the flowers. And I was really pleased that when Chris got asked the question about shopping, etc., he didn't have to repeat his message of last week, which was don't eat the packaging.
Yeah. No, that one stuck with us.
No. Do you know, I haven't eaten any packaging all week because of what you said, Chris, because normally I have loads of it every week. Eat any.
Thank you both.
I'm very pleased to hear that.
Good.
Very nice to see you again this Saturday morning, and we appreciate your time and your expertise. It's very helpful to us.
Pleasure.
And thank you for everyone who's sending those questions today. It's something I know a lot of people find really useful, and it really helps us because, as we always say, there's no such thing as a stupid question in these situations, and often the questions are the same, just different, in different ways, but all works.
We've built our entire careers on it, Charlie.
That's true.
Time for Saturday Kitchen.